Welcome everyone and introduce them to the polls.
I will. Welcome everyone. I am really pleased that you've joined us today, and I'm really pleased that actually you decided that learning disability and autism was the topic you wanted to look at, because it is a subject dear to my heart. You don't want my potted history, but one of my first jobs was working in a long-stay mental handicap hospital, looking at how the needs of these children were best met. And I've followed their journey into the community ever since. So it's really important to me. And I'm really pleased at the sort of variety of speakers and workshops that we've got for you today. So the real goal of today is to link up. One of the challenges of our world at the moment is there's all sorts of initiatives, all sorts of programs, all sorts of developments. And sometimes it's really hard to get a full picture of what's going on and where and how that links together for the joint benefit of children and young people and their families. So today is very much about the elements of the programme coming together. So in our first session, you've got the NHS England Leads coming to talk to you about the broad programme, its part in the long-term plan and some of the initiatives coming out of it.
Christine, you're muted again.
It says someone in the meeting muted me. So listen, if I've suddenly got boring you lot, you've got to tell me. You don't have to keep muting me. And what I was trying to say was quite exciting, because one of the pieces of work Amanda and I did a few years ago resulted in a commitment in the long-term plan that all children at risk of going into Tier 4 services or in them would have a key worker. And that programme's now underway. You'll hear more about that today. But if you're interested in it, and please be interested in it, there is a national key working conference in 2 weeks. Marie, I'm hoping, will put the link in the chat for you so you can register that. It's a free conference and really looks at what we're trying to do. And one of the things out of that for me that's really important is the key working pilots on that in that work are based in health, but they're also based in the voluntary sector and they're also based in social care. So it's a real understanding of how the system comes together around the needs of children. And then you've also got the wonderful Ian Lewis, because one of the things we wanted to look at as part of the programme was to look at the challenge of children who've been in hospital a long time. How do you unlock the risk for the community? How do you help people make collective decisions about risk and come out with some of the work? And then later on, you'll also get the Autism Strategy where it fits. So lots and lots of information in our broad opening programme, and including the work we've been trying to get to from Bradford. So thank you, Bradford. This is a piece of work on early identification we've been really keen on understanding. And you've then got a range of workshops that you'll see, which really go right across the spectrum of training and support and parents and strategy and linking, and a workshop on the SEND review and where it's got to, and its focus on ordinarily available provision in schools. So I think we have got a really rich afternoon, and I'm really keen on it, because it starts to feel like, with a bit of luck and everything crossed and not being muted, that the world might come together in a way that starts to make sense, which is the basic goal of the afternoon. One of the things we've got, before I hand you over to various people, and you'll be glad to know that Marie, who is sat next to me, is in charge of the technicals, not me, otherwise it wouldn't ever happen, is we have 2 polls. Now the first one, is this the one from Lorraine?
Yes.
Okay, so this is from Lorraine Mulroney, who's the National Designated Lead in the NHSE for SEND. So from her perspective, she's asking, this group of children, remember, autism and learning difficulty, what would make the biggest difference to support you in the local area in the next 2 months? Right, I feel that I am now on Strictly. If you watch Strictly Come Dancing on a Saturday, you'll know they say, and now we have our terms and conditions. So I'm going to hand you over to Marie, who is sat next to me over here, you see, to say, Marie, tell them how this works.
So there's a web address here, that if you click on it will take you to the poll on your smartphone. And Daphne will just put that in the chat now, so you can click on it easily. But if you have a smartphone available, that's easiest to go to the internet and type in that address, and it will take you to the online poll.
Thanks, Marie. And can we also, for people who might be able to multitask or possibly want to do this once they have entered the poll, can you also introduce yourselves in the chat and say who you are? Because obviously we haven't got a hope in hell of getting around you all, but it's lovely to know who's here and where you're from.
Right. And yes, Zoe, we know about the feedback. That's just a challenge at our end, but we can stop that happening a bit. So we do our best. Okay. All right. Yes. We got lots and lots of stuff on risk registers, don't we? The whole heart of some of the work we've been doing with many of you is that whole stuff about what makes a dynamic risk register or a dynamic support system or whatever they're being called. What makes it dynamic? What keeps it going? What adds heart to it, etc. Okay, yes. All right, some of the good practice coming through. Lots and lots of stuff on waiting lists. Thank you. And yeah, one of this stuff about I'm fairly convinced at a national level we don't have the pathway right. I think there are still gaps in it in terms of the sorts of support that people need, and pathways coming through. So it's probably worth, as you respond to the poll, me telling you something about the things we're involved with. So one of the things we're involved with 3 things at the moment, really. One is the key worker programme that we've talked to you about. The second is the Independent Strategic Oversight Board. So that is an NHS group looking at the quality of inpatient care. So if young people are in inpatient settings, how do we build quality? How do we build effectiveness? And how do we build readiness for discharge? So that piece of work's going on. And then the third thing that's going on, chaired by Anne Longfield, who was the previous Children's Commissioner, is some work across the piece on steering children and young people's activities. So where do they fit in with the autism strategy? How do you cross some of the things that's come up on here, that sort of dynamic between autism and mental health? So we know that 70% of all children diagnosed with autism will also be diagnosed with a mental health need. So how do you cross the pathway, which are very separate at the moment, from autism and mental health? And are we clear around which interventions work? So one of the things we've been looking at is the RFID programme. So this is about children with eating disorders, and what was clear was that the standard programme did not work for children with autism, and that lots of children with autism were being diagnosed with eating disorders. So what was the pathway that had to be done that was different, and how was it adapted? And there are a number of local areas that are now trialling that to see if it works. So one of the things I think, looking at Amanda, we will want to do with your thoughts, apart from this going back to Lorraine, is also looking at where are the current national programmes coming up with some of this, and where are the absolute clear gaps that you're identifying at a base level. Yeah?
Absolutely. And I should probably introduce myself, shouldn't I, Christine? I just assume everybody knows who I am. So I'm Amanda Allard, and I'm Christine's deputy. We've got 1 minute left before we move over to Sue, Christine. So do you want to do the other poll?
The other poll is a favour for the DFE. Oh, look at that. Is that done? All right, good. One of the things we were asked to test, which we've been doing across a number of our programmes, including SENDIAS services, thank you, Catherine, is looking at how does it feel in return to school. There are lots and lots of anxieties about return to school. So it looks like things are relatively going well. We think they are from our point of view. That doesn't mean there aren't children off with COVID and COVID related things. There are. And it doesn't mean we haven't yet got back to full attendance, because we haven't. But in the general processing, we are looking at where are we on return. Now, the reason that's important today, apart from seizing any opportunity that goes, is also because for many of these children, being in school and being part of being in school is a real protective factor. So can we get these children back in school? Is it working well? How are we doing? So there you go. Right, it says answer why on next poll. I'm looking at Marie. She can't talk because she echoes. Okay, if not, why? Well, so they will come in. Keep doing this and we'll come back to it if we need to.
Yeah, absolutely. We can sort of get do a little bit of a summary for people at the end, but they don't have to sit and listen to us narrate as they come in.
No, and I suppose what is coming in is probably what we sort of expected to see. So yeah, it means that we can. The important thing about these polls is it means we can feed this back in real time in terms of how government policy is developing, because as Sue will agree, because she's smiling at me now, there is still a massive piece of work going on across government in relation to COVID recovery. So this is where this feeds in and what it does. So I'm going to shut up. I have great pleasure in welcoming Sue and Phil. I think he was here somewhere. Sue heads the Chun Young People's programme here, and we're delighted. And thank you, Sue, for making the time. It's always good to see you. Over to you.
Thank you so much, Christine, and really nice to be here. Thank you for inviting us, and nice to see some people that we've known in previous lives. We were really pleased to be invited to join you today. As Christine said, I'm the head of children and young people in the Learning Disability and Autism programme at NHS England and Improvement. And Phil, I'll let you just introduce yourself.
Hello, good afternoon all. I'm Phil Brayshaw. I'm Sue's deputy.
And so we're really pleased to be able to come today and to share with you some of the key elements around our programme of work in relation to children and people with learning disability and autism, sharing with you, I guess, some of the priorities that we have both within our governance structures and our boards across both NHS England and with our other government departments. And to share with you, I guess, the key priorities and the work that we're leading on. Christine has talked about some of them today, so we'll just talk a little bit more as we go through. So I hope it's helpful. We're very happy to take questions at the end, or you can pop them in the chat, but it might distract me. So, but feel free to do whatever suits you the best. All right, so thank you. If we could just move the slide down. So I guess I just wanted to share with people that, you know, we've had some changes in our senior leadership at NHS England and NHS Improvement. I realised I probably should have put these pictures the other way around. So Simon Stevens, who was our chief exec for a very long time, has moved on, and Amanda Pritchard is our new chief exec. And then for our Learning Disability and Autism programme, many of you may well have known Ray James, who was our national director for several years. He retired at the end of last year, and we've had a bit of a gap, but we are really pleased to welcome, and in fact he's officially started this week, Tom Carhill, who has joined us as our new national director. He comes to us from Hertfordshire Mental Health Trust, where he's the CEO, and he will be joining us as of now, working a couple of days a week until Christmas. So we're pleased to have him join us. I would want to say that kind of, although we've been without a national director for a while, that Claire Murdoch has filled that role. So Claire Murdoch is the national director for mental health, and also kind of covered learning disability and autism and mental health. Obviously there's such cross-cutting themes across our work. And that's been really helpful, and she'll continue to be really closely involved with the programmes as we move forward. So I guess I also just wanted to reference, and I know that you've had other sessions around integrated care systems, but I guess just to put, on the agenda really, that, we have big changes in our health architecture, and we know that, there are some opportunities, but also some, potential challenges and risks, and we know people are anxious perhaps about where children sit within this. So, just wanted to share with people, I'm sure you're aware, the proposals are around integrated care systems developing across 42 footprints in England. Those are their 4 key purposes around improving outcomes, tackling inequalities, enhancing productivity, and supporting broader social and economic development. So for those of you that perhaps have worked for a while in learning disability and autism, you may be aware that we used to have what was called transforming care partnerships. We have 48 of those. So we've now got kind of 42 ICSs. We've got a couple of areas that are still in between and are working on that. So in terms of some of our structures, it perhaps isn't quite as big a shift as it is for some others. We are really aware, though, that for particularly for local authorities and as CCGs, are more regularly merging, that, people are concerned about what that might mean for children and young people. And there has been a commitment that there will be some specific guidance around what that looks like, and particularly kind of around how that works with integrated care systems, the board, the partnerships, and then kind of the place-based delivery as well. So we're continuing to work with our colleagues in the Department of Health and Social Care and DFE in terms of the development of that guidance. If we could just move on to the next slide. And again, really just, putting up some of those key points around, the ambition behind the collaboration of ICSs. And I guess really importantly that there has been kind of that clear commitment that NHS bodies will, the ICS NHS bodies will take on the CCG statutory duties. So I guess although there's still a bit of nuance around how and what that looks like, I think we are clear that it won't negate any of those in the system. So I just wanted to kind of put that front and centre to say we know, as ever, change is challenging, it's complex, and the ambition, I think none of us would disagree with the ambitions around the purpose of it, and let's use it to the best opportunities that we can to improve services. So I then just wanted to talk a little bit about some of our governance structure around learning disability and autism. And again, I'm sure you're all aware, we've kind of had the ministerial shuffle over the last few weeks. So Helen Whately was our minister at the Department of Health and Social Care. That's changed, and she has been replaced by Gillian Keegan, who has come to us from the DFE. So although not working in, across perhaps the area in DFE that we have the most contacts with, still coming from that background is helpful. She is now taking the ministerial lead on the portfolio for mental health, learning disability and autism and social care. So a big portfolio, but again, helpful, I think, in terms of the interdependencies across all of those, particularly for our programmes of work. So some of you may have been aware, if you were around in the transforming care era, that there were a range of kind of governance boards that oversaw that work. There was a delivery board and a programme board, but they were hosted by NHS England and Improvement. And I think there was some reflection towards the end of the programme that really perhaps wasn't the most helpful way to manage the governance, because actually the interdependencies for meeting the needs of children, young people and adults with a learning disability and autism is absolutely kind of a cross-system, cross-government responsibility. So we're really pleased when the Building the Right Support Board was developed. So that's chaired by the Minister, It includes members, its membership includes the other government departments that are key to this work, the other arm's length bodies. We have a stakeholder group that's made up of voluntary sector partners and people with a lived experience, and there are representatives on the board. And that board has come up with the 5 priorities. I think it's on this slide and the next slide. There you go, got it twice. That we feel are really important for progressing and making sure that building the right support, making sure that people with a learning disability and autism have a good life, are able to access the services and support they need, particularly when they're potentially in crisis or at that point where they may need much more specialist support. These are the priorities that we think are really important to making those happen. So although transition is in there, obviously from our perspective, making sure children and young people are in every one is really, really important for us. And I'll be talking in the next few slides around potentially how we're going to do some work with the Building the Right Support Board to make sure that there is that focus for children and young people across the board, as well as just with the transitions work. So that then leads me on to our next board that again kind of Christine referenced, which is our Children and Young People Steering Group. So it's independently chaired by Anne Longfield. Christine's a member on that board, and we have other partners as well. So we've agreed that our steering group is kind of in essence the children's arm of the Building the Right Support Board. So we in our steering group will be looking at the action plan, making sure that those considerations for children and young people are in there. And we agreed in that our priorities around children and young people are these priorities. And we think these reflect the learning that we've kind of had from the system over the last few years. And, I'd be interested to hear your thoughts around if this chimes with you about some of the key priorities. We know that supporting identification of autism is a huge challenge. The waiting lists are a huge challenge. We know the responding positively to children in school. I think for us, both in terms of preventing avoidable admissions to mental health inpatient units, but also in terms of preventing admission maybe to other institutional types of care, doing what we can to avoid exclusion from school is really, really important for children in that pathway. But we do know there are some children that might need some targeted intensive support, and then a small group, but really important group that might need some really highly specialist provision. And then transition. I think in my working lifetime, transition's always been a priority. We still haven't got that right for children, and that aligns absolutely directly with the Building the Right Support Board priority as well. I'm aware I might be running on a bit too long, so just give me a little speed up sign if you need me to speed up, Amanda or Phil. So I guess then we just wanted to pull it right back to what are our commitments in the long-term plan from NHS England for children and young people with a learning disability and autism. So our key commitment is around reducing the number of children, young people and adults with a learning disability and autism. I can see that I've not quite finished the sentence there, who are in mental health inpatient hospitals. So we have some really key targets around that. By 24-25, there should be no more than 12 to 15, and 15 is kind of the top high end. We really would want to be looking for the 12 per million children in a mental health inpatient hospital. We know for many of our children, outcomes are not great. It's not always the right place to meet their needs. So we really have that top line commitment for us. As Christine said, our key worker commitment on the back of Christine's report, these are our children. A really important commitment for us in NHS England and improvement, with quite a significant investment attached to that over this long-term plan period. We have piloted that approach. We've got early adopters this year. We're looking at full footprint coverage next year across England. Our other commitments are around increasing annual health checks. for those with a learning disability. For us, for our children and young people, that's aged 14 plus. There's also some pilots around annual health checks for people with autism this year, but that's our commitment for those children and people aged 14 plus, and really important because of those interdependencies about healthcare, how they impact on people's well-being and mental health as well. So really committed to that. Testing new approaches to autism diagnosis, improving the quality of inpatient care. I'm sure, again, you'll all be very familiar with the awful stories that we hear sometimes about the quality of care and the experience of people in some mental health hospitals. And our continued commitment to dump and stamp. For those of you that may not have heard that term before, that's about stopping the over-medication of people with a learning disability and autism for adults. Lots of evidence about the overuse of psychotropic medication. And STAMP is supporting treatment and appropriate medication in paediatrics. So that was kind of our approach for children, where there was some different kind of challenges, sometimes around accessing the right medication and the right oversight, as well as making sure that it's about helping children live the best life they can. And then my final, two more slides before I hand over to Phil. Just wanted to share with you so you can kind of see what our overarching learning disability and autism programme looks like in NHS England. So we have our key 5 teams. Of course, we're at the top, not that I'm prejudiced in any way. So our children and young people are first. And we're really, really pleased that we're also kind of supporting and now our SEND team in NHS England also, although it's cross-programme across all of the children's programmes in NHSE, sits with us as well. So really pleased about that. We have an autism team that's a fairly new team in NHS England. We have an improving quality team that works across a whole range of different elements that's around improving the quality of care, particularly around our inpatient care. Our health improvement team that has that real focus on annual health check, stamp and stamp, and our strategic commissioning team that looks at those issues around strategic commissioning, mainly across adults, but works closely with our children's team as well. And then we've got on the little blue slide table, talks about some of the other groups that there are in NHS England and improvement for children and young people. And we're linked with and work with all of those, but they sit or are hosted by other children's programmes across the organisation. And then finally, just before I hand over to Phil, I just wanted to kind of refresh people's minds about some of our key policy documents that underpin our work. And some of these now, we've kind of had for a few years, but we believe are still kind of the right principles about what we're trying to achieve. So building the right support still underpins our work. It's about, how we make sure those principles of the service model really work well for individuals. The dynamic risk stratification process and the registers, Phil will talk about a bit more. Care education and treatment reviews, we see them as a real important part about making sure children and people get the right support at the right time, and we're preventing inappropriate admissions. And then for us, for children, and if you've not seen it, we will put the link in the chat, our guidance around developing and supporting services for children and people with a learning disability, autism or both. We think that's really key policy guidance that should be supporting delivery. So if you've not seen that before, please do have a read. We will need to update some of these. Some are already, we're updating in terms of, some of the new health structures and potential new legislation that will be coming out. But if you're not familiar with these, please have a little look. Phil, over to you.
Thank you, Sue. So thank you. It's really useful. Sets a strategic direction and the governance and the commitments of the long-term plan out. And I think when I introduced myself as Sue's deputy earlier, let me kind of tell you a little bit more about that. So I'm Deputy Head of Children and Young People at NHS England, and what it means is within that strategic direction, within that governance and looking at those commitments, one of my roles is to support Sue in making sure that the work's done to deliver those commitments. And so one of the things, or what I've been asked to talk about a little bit today is some of the work that underpins those commitments. So as a team, as a children and young people's team within the Learning Disability and Autism programme, we have a range of work streams that we're looking to deliver to improve the experience of children and young people and their families. Each of those work streams is headed up by a senior programme manager and experienced in the context of that work. I lead in the area of admission avoidance, improving community services and reducing inappropriate admissions. And my background is as both a learning disability nurse in provider services and as a local commissioner of disabled children's services. We have another work stream that looks at improving quality, primarily quality of inpatient services, including reducing restrictive practice, and that work stream is led by my colleague Hannah. And then we have the key working programme that's been talked about already today, and which I will touch on again, which is a key part of the development of support for children, young people and their families. And we have a fourth work stream. That work stream is led by Kate Sutton, who lots of you will know. And the fourth work stream is around sensory checks. So that's dental, eyesight and hearing checks for children and young people in residential special schools. And so that's essentially the work of the children and young people's team. There are, I think we've named around 18 separate projects within that, and I'll talk about around half a dozen, maybe a few more than that in the next slides, where there's the most considerable investment or the potential perhaps for the biggest impact. So the first one of those projects is the work we're doing around autism diagnostic pathways, and so that's around making sure that children and young people who need a diagnosis receive one as early as possible, that the waiting time is as short as possible, and that they're supported before any diagnosis and after any diagnosis, so whether that's a positive diagnosis of autism or not. So it's around supporting children and young people to receive the right diagnosis and the right support whilst they're waiting for that diagnosis. And there's, as you can see in the top corner, significant investment over the next 3 years around that, which will lead us to form a plan and best practice. So I think that's the beginning of some people's journey, and an important thing to get right. If I can move on to the next slide, please.
Sorry, before you move on to the next slide, I've had my hand up for quite a while. I've come out of the meeting a few times because I can't actually see any of these slides. And I was just wondering if somebody could share them so we can see, because there isn't a chat box on this, so I've not been able to make a comment. Sorry, I do apologise for interrupting.
That's okay.
Don't worry. Most people can see, and there is a chat box, but if there are technical difficulties, we will pick it up. And
can you put your email? Oh no, you can't put your email in the chat box.
Marie's doing it.
Good. Marie, can you find Val's email and please email her the slides? Thank you. Sorry, Val.
It's all right, don't worry. And it's a really easy email address, mine. It's val.walsh@nhs.net.
Val,
Kathy's hand is up as well.
They're going as a separate individual attendee. I don't know why, I've never seen that before, but if you click on the slides PPT, they will come up, but I've never come across that before.
Can I just say I can't see the slides either, so if you can send them to me. I've been clicking on download and all the rest of it and it isn't working, and I can't type a message either.
And what's your name, please?
Gillian Trivas.
Okay, Gillian, we'll work on it.
Thank you.
I've got the same problems. Kathy Rose.
Kathy Rose, okay.
Thank
Marie
you.
is sending you all copies of the slides, yeah? She's typing furiously as we speak.
Thank you.
Okay, and Phil, you're going to run out of time in a minute, isn't he, Amanda?
Oh, this doesn't count as my time, Christy.
How fast can you speak, Phil?
Fairly fast, I think. Fairly fast, and so I will make the assumption that everybody will get these slides. There are contact names and addresses on these slides. I'm happy to, and the team are happy to pick up any further conversations. So maybe what I'll do is kind of name the programs, name the investment, and then we can pick up the detail either in future webinars or individual conversations or a combination of the two. So the first thing that I wanted to talk about was the diagnostic pathway work. The second part is investment in community services. And again, there's significant investment, 25 million this year, 40 million next year, 80 million in year 3. And this is about improving community services for children, young people and adults with learning disability or autistic children, young people and adults. And it's important that people are aware of that investment and that people are talking locally about how they might make best use of that investment across a range of services that support children, young people and adults in crisis, close to admission, when things perhaps aren't going as well as they should, particularly. If we could have the next slide. So we're doing some work with the Health and Justice team to help them to recognise autistic young people who come into contact with their services, perhaps who have not had a diagnosis, to be able to recognise those people and to signpost them to the relevant services. And the next slide, please. So key working we've heard a lot about, again, significant investment. We're working with 13 pilot sites, 14 early adopter sites this year, looking to move that to full coverage next year, and then to extend the role and include young people 18 to 25 in year 3. So again, significant work, significant investment, which I would expect people to be cited on. As part of that, and I think Ian's talking next, we won't cover the same ground. There's a senior children's intervenors who are looking to support children with the most complex needs who are perhaps stuck as a consequence of a response, inappropriate response from the system, maybe. And the next slide. So the next 2 or 3 slides talk about the mental health action plan. So this is spending review funding that's been put into the system as a response to COVID. The first piece of work we're doing, and I've seen that Julie Bates from North Cumbria North East is on the call. There she is waving to those who can see her. And Julie will happily pick up with areas conversations around this, I know. It's an investment this year to look to support the development of mini carer forums in school, to improve the experience for autistic children and young people, to look at putting some training around autism into schools, to improve the CAMS offer and the mental health offer to autistic children, particularly those that might be close to exclusion, and to look at how reasonable adjustments can be made to make sure that reasonable adjustments are made to make sure that autistic children can be successful in schools. We've just seen that 2 workshops this afternoon, so book early for those. The next slide is around waiting list triage. So this is money that we're putting into local systems to asking of local systems, are there autistic children waiting for mental health services? Are there children and young people on autism diagnostic waiting lists that are potentially at risk of admission? Could local areas identify those and expedite their support and treatment? And the final one is an increased investment in health-funded respite. So again, for those children and young people, risk of admission to Tier 4 hospital, would some additional support around respite and short breaks provide an alternative to admission, were it provided? So I think maybe 8 slides out of potentially 18 programs of work they're doing. I think one of the things that I'd be keen to do is just encourage people as they look to those slides, have those conversations locally. What are we doing? What does this work look like in our area? And also, does it connect? So I talk about community services development linking to health funded respite, thinking about how then you support people in schools, how you identify people on dynamic sport registers, who might be eligible for a CTR. So it's how do all of these things connect in your local area? How are you making best use of them for your local children, young people and families? I think it's back to Sue just to round things up.
So I think we've overrun, so I won't talk to these slides. This was just to kind of share some other things that are happening that are across all ages. But again, happy if we share the slides and you know, if you've got questions, let us know. So sorry, that wasn't a very well timed whistle stop tour across the Learning Disabilities and Autism programme for children and young people. But we hope it's been helpful.
And I guess so. Sorry, Sue, just to flag, we do have some separate webinars on those individual projects. I know that Julie's got some workshops this afternoon, but also some other webinars in the pipeline, so we can make sure that people are aware of those should they want to know more about any of those things.
We're going to send around the details of the key working one with the notes of today, Phil. So if there are any others that you want us to advertise at the same time, just get the team to let us know.
I think it's just an indication of just how much is going on. So that is good in terms of the fact there is a lot going on. It's just sometimes quite hard to get your head around it. So we do our best. And thank you all of those of you who are working on the chat. There's a huge amount going through, and we will capture that as well, will we not?
We will. And thank you very much to Sue and to Phil. And sorry not to. I mean, hopefully we will carve out a little bit of time for some questions, sort of as a group at the end. Are you able to stay, Sue, or do you need to disappear?
Do you mean at the end of the entire session, Amanda, or?
Well, I was thinking after Ian, maybe.
Oh yeah, I can. Yeah, I'll stay.
Okay, am I introducing Ian or are you? I'm delighted to introduce Ian.
You go ahead.
This piece of work came out of the early work that we were doing on key working, looking at some of the challenges of children who were in the system. And I won't say more because Ian will, and he'll do it much more eloquently than me. So Ian, you're on wherever you are.
I'm here. Yes, can people see and hear me? Yeah, well, thanks very much, Christine. I'll do my best to meet the expectations you built up on my eloquence. But so I'm here to talk a little bit about the Senior Children's Intervenor, which is a pilot project and associated with the key working programme. But just a little bit about me. You'll have seen in the agenda that I was, my title is the National Children's Services Advisor for the Children's Mental Health Programme, which is absolutely true. That is one of my roles. My professional background is as a children's social worker and with sort of senior management experience. So I'm bringing into the Senior Children's Intervenor role a sort of experience in the children's social care setting, but also a knowledge of the children's mental health programme. So I think that's a little bit about me. So if we go to the next slide, please. So as I say, the Senior Children's Intervenor is a sort of pilot project. It's aimed at enabling young people with learning disabilities and autism to move to the most appropriate setting from hospital when they've been identified as being inappropriately held in a secure ward. And I suppose probably by inappropriately, that's generally meant for a very extended period of time. And some of the young people that we've been working with have spent many years in hospital settings. Some, though not all, will be in long-term segregation. Some have spent time in long-term segregation. And I think, as Sue and Phil both said, it's an important part of the key worker initiative set out in the long-term plan. And as the key worker initiative rolls out, I think our relationship with key workers will be particularly important. Up to now, the referrals have come generally from NHS commissioners who, generally in specialised commissioning, who have been concerned about the length of stay of a child. We are working towards a more systematic way of identifying children with a sort of threshold where a referral to a senior children's intervener should be considered. So, up to now, there are 3 of us in post since May 2020. One of us had been, not me, I've been working with for several months prior to that. I do a role as a senior children's intervener, but I also do some of the coordination of referrals and the support for the other 2 in terms of, just pulling together the information. And to date, we've worked with 16 children, although 2 recently allocated bring that up to 18. And of the 16, 10 have been discharged to community settings, and a further 2 moved to less restrictive settings. I think, just wanted to make the point that these are they're mainly amongst the most complex in the system, although some of the children don't actually necessarily have the most complex needs, but somehow they still got stuck. But it's important, I think the rest of the presentation goes through where we have learned about what's going on. But it doesn't reflect where systems actually and plans have worked well. And I think when we're thinking about the system as a whole, we need to learn from what works as well as the situations where things haven't worked. But I think next slide, please. So I'm just going to go through in the next slides some of the issues that have arisen. In many cases, all of these have arisen, but they're features of at least one of them all. And the first one is around resources, which I don't think will come as a surprise to any of you. So a lack of suitable resources available, and that's both within the inpatient estate and within the community to enable discharge, and indeed to prevent admission. I've certainly worked with a couple of children where really an analysis of saying when they initially came in, it probably wasn't the right thing for them, and if there had been an alternative, they may not have had to be in hospital for several years. But that's not just resources in terms of placements; it's also resources in terms of the available community support, and I think that's where Phil's points around the developments of community support will be so important. So in some cases, we've had to really set up bespoke arrangements for those children and young people because there was simply nothing available at all. And particularly one of my colleagues is working with 3 young people where essentially we've almost had to build something from scratch. There's considerable pressure on the available placements. That's both NHS and local authority, and I think in some cases the market has just not developed the provision that's needed, and as I say, the community arrangements, support placements may not be available. And I saw in the chat, and I'll come on to the transitions to adults. I just started one of the cases I've just taken on. It's the real sticking point is the availability of adult mental health support for a young person with autism who has had her 18th birthday on Sunday. But that will be a real difficulty in enabling her to make a successful transition back into the community. So the financial arrangements and the requirements are often really substantial, and that does take considerable negotiation. And I think there are issues about where finance gets transferred, where budgets are moving from specialised commissioning into either local authority or CCG/ICS arrangements. I think provider collaboratives may offer some solution developing market, but the local authority element in the provider collaboratives, I think, is still in development in a lot of areas. And I think that all of what Sue was saying about the architecture, I think it's going to be really crucial in how ICSs and provider collaboratives work together with local authorities to develop markets and resources and community resources to support these children and young people. So next slide, please. Next sort of issue I think is arising as broadly as I've described as processes, and as I said, these are the cases where those processes haven't worked, because they often do. But the CETR process, which works very well in many cases, but in some cases it just hasn't been sufficient to drive that change and resolve the issues between agencies and to escalate sufficiently quickly and robustly to senior members of the organisations. Sometimes there's and I'll come on to this in the next slide a bit about the agents. Sometimes there's a lack of knowledge about the processes that are required within those processes. So I see CETR decisions, but sort of invoking the local authority will do something, and they will sometimes be vague about whether that's the special educational needs part of the department or whether it's the children's social care. What's the legislative processes, and similarly local authority staff often don't understand the medical processes that are required. And so as the senior children interveners, I mean, all three of us do have senior experience. I think we're able to engage with senior leaders and escalate matters with the urgency required. But I think there are questions about why, in a sense, that ought not to be needed. The next slide, please. So I suppose building on that, I think there are often problems with interagency relationships, and sometimes those relationships have, I think I've arrived at cases where the relationships have just stalled, and part of the role is actually in terms of trying to resolve and unpick the blockages. So it can be between local authorities and NHS colleagues, but it can also be between the inpatient service and the community national health services, so the CCG or the community or the provider trusts and provider collaboratives. Sometimes slightly different approaches to working in partnership with children and their family, and again that sometimes goes back to different understanding what legal processes. And I think where it's been effective, our role can enable some better mutual understanding of the different roles and responsibilities. I've got a sign saying I've got bad network quality, so I'm plowing on unless somebody has been telling me that they can't hear me. But please let me know if you can't hear me. So again,
you're all over it. You're nailing it.
Again, escalation, our role is, where these relationships have been stuck, again, may need to be about escalation so that senior staff can intervene and enable more constructive behaviour. We go to the next slide. I think there's a broad issue about capacity, and I think that one of the really key issues is often cases are held by commissioners with very high caseloads. And so when we get the really complex cases, that makes it very difficult for them to simply have the time So I think we've all worked with really able and knowledgeable commissioners who just have not been able to take things forward and sometimes aren't empowered to escalate appropriately, especially outside their own agencies. Some don't have knowledge about what's required to take things forward in different agencies. And I think this point about sometimes within the team, there will be staff who have not worked with cases of such complexity, and I think of that particularly with social workers. Many social workers that we are working with have never worked with this case, and possibly, in my career, I probably worked with one or two. And maybe as a senior manager with a few more, but these are extremely complicated cases. So I think on a positive level, I think, generally our experiences as professionals working with these children are really committed to finding solutions and ways forward, despite all of the practical barriers that are placed in their way. And we've worked with some really committed people who want to get things right. So I think there's a great deal to build on. So the next slide. And then I think a practical issue is about transition to adult services, and that's an issue for both NHS and local authority organisations. I mentioned the issue around adult mental health, and in the broader children's mental health programme or long-term plan programme, that issue around providing mental health support to 18 to 25-year-olds has been identified, not just for children with autism and a learning disability, but mental health services in general. That requires some thinking because when children are significantly longer than 18, nearly all of the children we're working with will need considerable support into adulthood. And I mentioned the bespoke arrangements that are being set up. Most of those are intended to be lifelong arrangements. They may develop, and there may be other young residents who will arrive if it's being designed in that way. But we need to think in terms of many years to support these young people. So those processes for transition are improving, but it's a really difficult issue in enabling a successful discharge and getting the right teams, and that's very frustrating for young people and their families and the relevant professionals. So I think next slide. So I think the summary, I mean, as I say, I'll just try to outline some of the overall issues that have prevented plans being taken forward in the cases that we've worked with. It's still at the early stages of the project. As I said, 18 young people, and I think longer evaluation will be needed. And as I say, I think that needs to include where things have worked well. But building on the project, there are current recruitment programs for senior intervenors to work with adults who are in long-term segregation. I think there are some signs that the role can be helpful. So, we are expanding the SCI role, and there'll be a relationship to the independent CETRs that are being re-established through the Baroness Holland's review. I think, there's a clear need for strategic commissioning of appropriate resources. And as I say, that's both residential and similar resources, but also community support across the agencies and sectors, and how that is going to be supported through the architecture that Sue set out. I think there's some consideration about how financial support means that the community arrangements are robust and sustainable. And I think, that there are economies of scale that are really challenging for some local authorities. One of the cases that we're talking about, we're negotiating with a local authority, could potentially cost 10% of their entire children's social care budget. I'm not talking about the children in care budget, I'm talking about the entire budget. So for small authorities, these are very, very significant commitments, and it's a real challenge. But there's a need to strengthen interagency relationships and the understanding of at an operational level of each other's roles and responsibilities. And I said operational, but sometimes that might be at senior level as well. So I'm going to, I think that brings me to the end of my slides. So hopefully that's within time, and thanks very much for inviting me.
Thank you. You're getting lots of applause, Ian. So it's a shame you're not in a physical room, so you could hear it. And Marie, who's in charge of the afternoon next to me, is suggesting there might be time for a couple of questions. So if anybody has a question for Ian, what's the best way, Marie?
Raise your hand.
If you put your hand up, we'll promise to find you.
And also, don't forget, Sue and Phil have kindly stayed on because we didn't have time for questions after their session, Christine. So if we can field questions for any of the three.
Okay, don't be shy, you lot, because you're not in the chat.
You know, you're not being shy in the chat.
Any immediate questions, or has all the information? Oh no, David. Yeah, you're active in the chat as well.
Yeah, often am. Sorry, gang. Yeah,
right.
It's just a quickie. I mean, all of this stuff is really welcome, and we've been fighting for a lot of this for generations. But I guess the quick question mark of the theme that I see in the chat and in the presentations is what we're doing about the things that aren't fitting within this agenda, but still have a significant impact. So everything from our general workforce strategy and planning to encourage people to come into the workforce and be skilled up, through to the market demand management and the work that we can do around that, and learning that we can do, through to comorbidity, where we know that ADHD and ASD have a 40% overlap, but also things like neurological conditions and heart disease and things come in. And that isn't even touching the LD agenda. A lot of our focus is on autism because there's a significant number of our young people with hospital risks or on the cusp of care. But yeah, so I guess it's an open question to all the panel about, this is fantastic work, but how can we best work together to also deal with those other factors, including the kids that don't meet the diagnostic thresholds, to ensure that we reduce our unmet need?
Okay, I think that's a 3-year work programme at least. But if any of the panel can answer it in the next 5 minutes, that'd be really good.
So David, it's a real challenge, isn't it? And I really wish that I had a bit of a magic wand, and I don't at all. I think, I really agree. I think there are some intrinsic issues that impact across the board, and I think workforce and our market development are key parts of that. That for years we've seen, have a huge impact across the board. I think for me, internally, we're looking at that, but as ever, we end up in those kind of, where does it lie? Who does it? Who should do it? How does that work? And I guess I'm hopeful that the Building the Right Support Board might give us a little bit more kind of commitment to coordination, because the bottom line is that it is cross-cutting, and you could be purist and say, well, actually, from a health perspective, we need the social care workforce to develop so that we can move children out of hospital. But it doesn't matter, does it? Because if children are in hospital, we need to develop the workforce. Is the bottom line. So I think those are things that are beginning to have a higher profile, and I think I'm hopeful that we might get a kind of a stronger cross-partner agreement to progress some of those things. And I guess you're right. Some of these things, some of the bits we've talked about today, have been years in the coming. And that's really hard for children and families that are caught in that. But I think we cautiously want to say, well, we have made some progress, we have got some priority, we've got a bit more resource than we had before, and we just need to keep kind of fighting and advocating to maintain that priority for our group of children across the board, and thinking around how we do work more collaboratively, so we don't have these silos of, we have autism but not ADHD, and so you don't fit this pathway and that pathway. And I do hope that that the ICSs might be one of the ways forward of doing that, about giving us a more integrated approach to our thinking that's based on need rather than perhaps always those diagnostic labels. So that's not really an answer, but I think that's the best answer I can give.
Thanks, Sue. I think Christine's got stuck on mute again. We'll go to Victoria, and then we should probably move on. Victoria.
Hiya. Thank you for the presentation. It was really informative. I think for me, I'm really quite concerned about the emphasis on autism and learning disabilities, and there's no kind of discussion around attachment, global developmental delay, and I know you kind of may have answered a bit of that before when you spoke with the other question, but just, is it going to be an autism pathway, or and then learning disabilities, like we need it to be a bit more inclusive than that, for me anyway. I don't know about anyone else, but I'm just a bit concerned by the emphasis on the autism.
So I think the focus is on autism because it's where we've seen the biggest challenge, you know, in terms of increasing prevalence, increasing pressure on services, the increased waiting lists for diagnosis. So I think, you know, there's something around that. I guess what we're really mindful of is there are huge interdependencies across lots of different elements, and some of the things that you were talking around in terms of attachment, you know, I think you'd put the comment, didn't you, about AFS and GDD, all those kind of interdependencies are across the board. So I think, you know,
it's definitely not just you though, because autism can be a very simple label to whack onto a whole range of different problems, and actually what we need to be doing is meeting need, not giving people titles, diagnoses, labels. Actually meeting need is where we need to be heading.
And I think that's kind of been, you know, a message for a long time, hasn't it? And you know, and we get caught sometimes in these intrinsic challenges around how we allocate resource based on diagnosis as opposed to identification of the need. And I guess for me, that's where you have power as local systems to influence that, you know, to help drive your own local strategic direction in relation to that, you know, your service provision being based on need as opposed to diagnostic labels in that sense.
Thanks, Sue. I was going to say much the same. I've been watching the chat, and there is so much stuff out there that's trying to challenge this and look at this. One of our roles working with Sue and the team and the broader NHS and social care and education agendas is to capture how these challenges are being left locally. I would say you have joined a conference entitled Autism and Learning Disabilities, so we don't apologise for the emphasis on autism, but actually one of the things we are learning across the piece is that whole interconnection between early speech and language sector communication difficulties, the whole neurodiversity pathway, etc. So there is something about that sort of and plus. Yes, some children have a diagnosis, yes, some children don't, but again, when we did the research a few years ago, there was an absolute clear challenge about diagnosis being an access point or a barrier, and it's something about how we design services so that families don't need to go down a specific diagnostic route. But that is a long conversation. We have not got time for it today, but I am really keen to understand how you are testing that locally and what comes back so that we can feed that into the national team as it develops. So we are, and thank you to somebody who put in the Mark Lovell link. That's very helpful. Yes, so can we actually move on to the autism strategy? Because this again,
so Christine, you're absolutely right, and it is a huge problem. And how we go forward from here, we all need to talk about it. So
that's fine. We go forward step by step. 42 years into my career, I go day by day, step by step. That's what keeps me sane.
And I think we're about to lose Sue and Phil, Christine. So thank you very much to them.
Thank you very much to them. And And lots of claps, Sue and Phil, and we will bring you back. Sorry, you've made a lifelong commitment now. So that's great. So thank you very much indeed. And we are, I think, lots and lots of claps. I've never seen so many. They are. You can go away with positive vibes.
Well, thank you for having us.
You're very, very welcome. And we are going to go on and listen to David, who's going to talk to us about the autism strategy, because it's another of the framing things. So all of the time, what we are trying to do is frame things around an autism strategy, an SEND review, a review of social care, the long-term plan, these frameworks where we, by nature, have to make sure that children's needs are within, but then are able to step outside them. Okay, so David, are you with us? Very welcome.
Yes,
please.
Hello. What a lovely introduction as well. Thank you for that. And yeah, echoing what other people have said, thanks very much for inviting me here to give a bit of an overview of the new autism strategy. My name is David Logue. I work in the SEND systems unit within DFE, and I specifically work on kind of policy linking with health and social care and the kind of interaction between SEND and in DFE and DHSE. So I'm going to speak a little bit about the new strategy published earlier this summer jointly between DFE and DHSE that I hope you're going to find useful, and I'm going to give a bit of a focus on how it's been extended to children and young people and some of the challenges for that group, and then their aspirations and outcomes we want to see following the strategy, with a special kind of look or nod towards the education side of the strategy, just because I've only got a limited amount of time and that's the bits that I've been most focused on. I'll also share the kind of gov.uk links and things like that through the chat, and can share them more widely. So if people can go and read them in their own leisure time, and if people do have kind of further questions following this event, or if we don't have time at the end of my presentation, I'm more than happy to pick up anything via email or something like that. So yeah, can we go on to the next slide? Thank you. So I just wanted to give a little bit of background about kind of where we've come from with the strategy, what the kind of legislative framework of having an autism strategy has kind of come from. So going back to the Autism Act in 2009, and it is still, 12 years on, the only condition-specific legislation of its type in England. And I really wanted to kind of focus on this kind of placing a duty on Secretary of State for DHSE meeting the needs of autistic adults. That was because at that time there were particular concerns in regards to services and support for adults. So that's kind of why it's just on adults in the legislation. So we had that first strategy that came out in 2010, and then the most recent one before this year's one in 2014, because in the legislation there's a commitment to kind of update the strategy with the new challenges and changes over time to make sure that it's always up to date. So responsibility is kind of shared across governments, but it is Department of Health and Social Care and the Secretary of State there who kind of signs off, if that makes sense. So yeah, next slide, please. So like I said, kind of moving on to thinking about the changes in society and the changes and challenges facing autistic people and autistic children and young people, especially. Government committed to review the strategy, like reflecting on those new experiences, listening to people on the ground, stakeholders, services, people and their families, of course, and the kind of commitment that came out of that was to extend it to children and young people as well. Just a slight anecdote that people might find interesting is that that commitment was made by Nadeem Zahawi when he was Children's Minister at DFE. He is, of course, now back as DFE Secretary of State. So hopefully, and I'd hope people would agree that that might be a positive thing for this space with the new strategy publishing. So yeah, extended its scope for the first time, and really recognizing the importance and the distinct nature of the challenges facing children and young people. And I think that that's something that was really key, especially through the DFE's involvement with this strategy. So yeah, could go to next slide, please. So just kind of talking through those kind of ongoing challenges and assessing those and the experiences changing since the last strategy. We worked with and listened to autistic people and their families and stakeholder groups through a kind of number of ways. One of those was the all-party parliamentary group on autism inquiry report in 2019, and some of their the kind of key challenges that were coming out of that report are kind of listed here. And you know, that kind of interaction and really hearing those new experiences and the ongoing challenges as well, and how the strategy could be updated to really best meet those needs. So yeah, next slide, please. So yeah, then as I kind of touched on, I wanted to show some of the kind of really specific challenges for children and young people, and we've been really clear since kind of the early stages of formulating the strategy as a whole that we know, and I think I can speak for everyone on this call. I can't actually see exactly how many people there are, but children and young people have very distinct challenges, issues. They are different to adults, and they need to be treated that way. They need specific provision. They need their challenges looked at separately. So that was really important and really a really positive step for the strategy to kind of be extended out to them. So all of these challenges listed, obviously not an exhaustive list, but some of the key ones that were kind of coming through and really building on why we should extend it past adults as well. So could we go to the next slide, please? So yeah, then kind of moving on to the strategy itself and that kind of 5-year vision. So the strategy is 2021 to 2026 strategy published. So underpinned by improving lives in these 6 key areas, and there are clearly the second one here, the improving autistic children and young people's access to education and supporting positive transition to adulthood, is a kind of specific one for children and young people, but that's not to say that obviously there's clear overlaps with all of these other areas, and we've been working with across government in Department of Health and Social Care, NHS, even Ministry of Justice, as you can see in that kind of final one, to really make sure that all of these areas are hit and that children and young people are included in all of the whole strategy. And then obviously as a kind of crucial element, as we know through everything that government's been kind of putting out in the last year or so, that learning from COVID-19 is such an important element of the strategy, and making sure that we're taking account of that and the lessons and the challenges that have been faced over these 18 or so months now have been addressed and have been looked at throughout the strategy itself. Can we get to the next slide, please? So yeah, so within the 5-year vision, next to the strategy itself, we published a first-year implementation plan. I'll also link that as well. There's separate gov.uk pages, but it goes into a lot of detail and kind of almost like KPIs of the strategy's first year. So we really wanted to kind of hit the ground running, make commitments and actions to be taken right away, with the kind of evidence and learning coming in through the first few months and this first year, ready to help with the further kind of 4 years of the strategy, and with a real focus, as you can kind of see through some of the kind of more granular detail here, on enablers being put in place, being able to kind of set up for the longer term vision and really demonstrate the progress being made. Like I said, there's detail here on some of the funding. I'll share the link to the implementation plan, which takes it down into even more smaller detail for you all to go and kind of digest. And again, more than happy to kind of talk through or pick up on email through this type of thing. Can we go to the next slide, please? So yeah, and then as I kind of mentioned at the start of the presentation, I just wanted to touch on some of the key commitments to the education and transition to adulthood, as they're the main areas of DFE involvement. So that this is kind of taking account of those specific challenges to autistic children and young people that I kind of set out. So it was really important to have specific commitments encapsulating this group, while still kind of being covered by many of the other wider commitments throughout the strategy set out, especially on the last slide. And you can see again through some of these even first-year commitments that they're kind of enablers for ongoing work, not just for the 4 years, but further on, especially kind of through the SEND review, is like a very key enabler of the strategy. And then can we go to the next slide, please? So yeah, the strategy is now published. It published in July, but we really don't want to kind of take our foot off the pedal. We've had really positive feedback from a range of stakeholders, children and young people, their families, but we want to keep kind of pushing on. So we're working with Department for Health and Social Care, so DFE and DHSE, to kind of refresh the executive group, which is a group of self-advocates, parents, and other kind of key stakeholders, to kind of monitor the data coming in through these first few months, and kind of look to how we're going to deliver the implementation plan. And then we're then needing to get ready for the kind of first ministerial accountability meeting, which is due to take place in January. I probably don't need to say that obviously we've got a lot of new ministers all over in every department, and clearly there's lots of briefing that has been going on, both in general for SEND, especially on the DFE side, but there's going to be some more specific stuff to get up to speed with, especially on, for example, the strategy, and then kind of finally, I wanted to just touch on that, like the future years of implementation and like getting into that same level of granular detail that I was talking about a few slides ago. We need to we're waiting for the next spending review that will then be able to kind of set out some of those subsequent years of kind of how we're going to implement in that kind of level of detail. So there are some I suppose government machinery of government type things that we're moving through at the moment, but it's making really positive progress. And I think that is it.
Okay, thank you, David. That was really, really helpful. And it's actually really nice to get the autism strategy presented by DFE. It's really good to see the cross-government development of it and the things coming through. And again, people have obviously found the applause reaction, so you're doing well as well, which is always very nice to see. Okay, I'm looking at Rachel because she's Rachel. I'm not looking at Rachel, I'm looking at Marie because she's sat next to me. Where are we now, Marie?
Yeah, I think we've probably got, there was a question in the chat, Christine, for I think we've probably just about got time to take that one question before we move on to one in Bradford.
Okay, I think if it's the one about the money for schools, I think I've tried to answer it for you, David, because I think it's part of your procurement processes that are currently underway. Is that right? Is this part of, one assumes that the 600 stuff is part of whole school send, or is it more than that?
Yeah, I can. So the £600,000 in that first year implementation plan. So that's 2021 to 2022. That is our current contract that we have with the Autism Education Trust. Yeah. I believe that there's a workshop with Sarah Broadhurst, the director, later on. So yeah, that's what that kind of chunk of money is describing.
And I know that you are committed to continuing that programme next year, and it's out for re-procurement, so which is just the nature of government processes. So yes, there is a lot on the Autism Education Trust website. If you haven't worked with them before and don't know the work they do in schools and what the offer is, just do have a look, because there's some really, really good stuff. Okay. And I love the fact, David, that we now have autism heroes. Tim Burton, Elon Musk, and many of his heroes are also autistic. And Anthony Hopkins. If any of you have got any more information on autistic heroes and you'd like to share them in the chat, please do, because that's the sort of positivity that we like. Right, and Anna has put up the Autism Education Trust website for you. So if you want to have a look at what the offers are and have a think, then do so. So David, thank you very much indeed. One of the things that David talked about as part of the government's commitments was to continue to support and develop the work of the Born in Bradford work. And we are really, really pleased that Born in Bradford are now joining us, because this is a really exciting piece of work and goes back to all of those of you in the chat who are complaining that we are not doing data. So there you go. We are coming back. So thank you very much. And over to you. So thank you very much.
Well, thank you so much for a kind introduction, and what a privilege to be here today. We're really excited about what's happening in Bradford, but we're excited because the need is enormous. We, like many, many other areas, are suffering from the inequalities that are blighting our district and blighting our country. And those inequalities are felt at the sharpest sort of end by individuals with vulnerabilities, and children with sort of disabilities are not being well sort of supported, and we all have a moral and ethical duty to start turning the tide on this issue. We've known the problems for a decade. So 10 years ago, Marmot publishes a review. We all berate ourselves, say this is absolutely unacceptable. 10 years later, the review says not only have things not got better, not only have things not stayed the same, things have got worse. And the time has come for action. And bearing in mind that Marmot's review was published before the pandemic. And we're following the lives of 13,500 children as they grow up in Bradford, which gives us unique insights into the pressures that are facing our children and young people, which is a microcosm of the pressures that are facing children and young people across the UK. And the data that we collected during the sort of pandemic were truly horrific. Inequalities are getting worse. And now as the tide recedes and we start to see what's left behind after these terrible 18 months, we can but ask ourselves, how do we stop this happening once and for all? We absolutely have got to start working together to shift the needle on inequalities and start improving life outcomes for everybody. Children with disability, young people with disability, we have got to make that levelling up rhetoric a reality. So we're taking this incredibly serious in Bradford, and we have developed an inequalities plan to start trying to turn back the tide. So our conclusions are that if we really are serious about tackling inequalities, we've got to stop that conveyor belt of inequality, which means we've got to start focusing on children, young people. And we've had hard debates within the district, but we're now committed to focusing on the next generation. And as soon as you start putting children, young people at the heart of your inequalities sort of plans, you start thinking, how do we best reach the children, young people, families? And that takes you straight to the educational setting, whether it's schools, early year providers or nurseries. So our inequalities plan is starting to sort of see how we can bring all of the bits of the system together, but focused on these educational sort of settings. We also recognise you can't suddenly flick a switch and suddenly turn the sort of a tide on everything across the sort of a district. And the logic that we've developed is that if we really, again, are serious about tackling inequalities, let's go to our most deprived areas and start in these sort of places and then build out from there in partnership with our communities. And we recognise that no single organisation can sort out these problems. The schools can't sort out these problems, the care trust, the hospital trust, the local authority, our voluntary sector. The only chance we have is to start connecting the fragmented system together with a pure focus on making life better for every child across our sort of a district. And it is our belief that data science, the ability to share information more effectively, is the way that we can start joining up the fragmented sort of system in order to change for once and for all the inequality landscape. So we're trying to pull together these sort of principles, this sort of quarter sort of arms in a program that we're calling Data One, which is digitally acting together as one, with a particular focus on autism. And there are three active ingredients within this piece of work. So I just want to go through the different parts, the different bits that we're fighting on in order to try and make this a reality. So firstly, we're trying to develop digital tools that will allow us to be much more effective in our delivery of services. And we're trying to see how we can start using data to start tackling some of the really wicked sort of problems that are facing our society. We're very fortunate within Bradford because we do have the Born in Bradford project. So over a 4-year period, we recruited all the pregnant mothers in the district, and we followed the mothers through pregnancy, we followed the children through birth, and now we're following the children as they grow up. And we have all of the routine data that describe these children's lives. So we have all of the health data, education data, social care data, together with transport data, policing sort of data. So we can really start seeing how services intersect and interact to determine outcomes. And of course, then we have very rich phenotype data and genotype sort of data. So we really have a fantastic test bed that allows us to start looking at how we can better identify need early and put appropriate support in place. And we're currently just expanding the Born in Bradford cohort to include all 30,000 sort of children who are entering secondary school over the next 4 years. So really exciting opportunity to start better understanding how all the different factors that influence children's outcomes come together and how we can intervene more effectively and deliver services that are tailored towards the needs of our children and young people. The most significant part of Born in Bradford, we believe, was just that routine data that we managed to connect. So what we've now done is actually expand that piece of work into a project we called Connected Bradford, where we connected all of the education and health sort of data and social care and other sort of data sets together to describe all of the young children and children and young sort of people across the Bradford sort of a district. And it's our belief that these connected data sets are really the way forward in properly supporting children and young people's needs, to the point where it's almost impossible to see how any of these organisations can meet their statutory responsibilities without better information sharing. And our observation is that almost every serious case review starts off with, if only that organisation had shared information with that other organisation. So how do we start that effective information sharing? How do we start using the power of data science in order to improve outcomes for children and young people? And I believe that we've already started to demonstrate the power of data science in improving outcomes for children and young people. Now, Bradford actually has a fantastic history of this. So back in 1907, a school just down the road from Bradford Royal Infirmary, where I'm sat, Green Lane Primary School, was one of the first schools to introduce free school meals for children and young people. But what they did that was really significant is they bothered to measure the impact of that intervention on their children and young people's weight. And what they showed is that when the children were in school, they showed normal development. And when there was the school holidays, their weight dropped, demonstrating that children were now nourished. And of course, the significance of that is now nourished children do not learn effectively, thereby showing that interaction between health and education. And that data, that information was then used to develop the legislation around free school meals. So it just shows the power of data science in shifting policy and helping us understand the different factors that influence children and young people's lives. And we've really tried to take that as inspiration within Bourne and Bradford. And we started to interrogate our data sets, and we sort of shown that a number of children struggled to learn to read because they simply can't see. So we started to put ophthalmic services into schools, starting to connect up health and education, and then we developed a randomized controlled trial to start seeing what the impact of that is on children's sort of outcomes. Likewise, large numbers of our children have motoric difficulties, perhaps low-grade cerebral palsy, and they're not getting the support that they need from our occupational therapy and physiotherapy services because they're on their knees. And the idea anyway that we want to get these sort of children out of sort of schools and into hospitals seemed kind of crazy before the pandemic and now seems completely nuts. So the data starts sort of suggesting to us that large numbers of our children are having their education affected because of their poor motor skills. So we can then use those insights to start developing interventions which are delivered in schools to support children's motoric needs. And we're doing similar things around children's physical activity. So we can start using the data insights to develop programs and test interventions that we feel have a real fighting chance of giving children the very best possible start in life. So that's the first component, this development of digital sort of tools. The second component is starting to work out how we can all act together to tackle these inequalities. So the inequality situation in Bradford can be demonstrated very well with this graph. So if you see the top of the sort of a graph, it shows you a 10-mile sort of a journey between Wharfdale, where I live, and Manningham, where the Bradford Royal Infirmary is situated, where I work. And that 10-mile journey results in a 10-year difference in life expectancy. But for me, even more significantly, it results in a decrease of 20 years of a healthy life. So the people who live in Wharfdale will live 10 years longer, and they'll have 20 years better quality life. I mean, this is just a disgrace. This is the year 2021, and we have such disparities in outcomes within a region. We've got to do something about this. And of course, we've heard already from Marmot about these health inequalities. We're all familiar with the health inequalities. But the point I want to make is that actually we can pick anything and we will see those inequalities sort of play out. So the children in Manningham also are unlikely to get good educational qualifications. The air quality in Manningham is sort of worse. We have much larger numbers of people who are unemployed, and so on and so forth. The point being that vulnerabilities multiply. Or another way of sort of saying this is that households in an area like sort of Manningham are far more likely to have numerous sort of problems playing out and therefore require more services supporting their needs. So if we take a child with undiagnosed sort of autism, that's a problem for us in Ilkley, and we need to start thinking about how we can support that sort of child's sort of needs. But if we take that sort of same child in Manningham, then it's far more likely that that child is also going to be suffering from food insecurity, from the presence of domestic violence in the sort of household, and so on and so forth. So we believe there's a real need for us to start using data tools more effectively to join up sort of services to reflect this concept that vulnerabilities interact. Or to put it yet another way, what we like to sort of think is that everything is connected, apart from the services that are in place to support our children and young sort of people. And one of the places that you can see the disconnect between our sort of service provision is when we look at health and education. And it almost seems as if we believe that you can split a child down the middle and take care of their health bit through these organisations and their education bit through these other organisations. And of course, that doesn't stand up to 2 minutes of scrutiny. So clearly there is a need for us to act together. And in Bradford, we're very, very fortunate to have the Act as One programme. And that is an attempt to bring together all the different bits of the sort of health service together with local authority to start being more effective in our responses to children and young people's needs. But the initial work was still very much sort of focused around health with sort of social sort of care, but without bringing the school sort of network into that sort of community. So what we've been pushing forward recently within sort of Bradford is bringing all of the stakeholders together. So bringing the school community into this partnership. So we genuinely have every stakeholder sat around the table when we're trying to develop creative and innovative approaches to better providing the needs of our children and young people. And one of the things that has come out of this partnership working is our Centre for Applied Education Research. We were very, very fortunate in Bradford to be part of the opportunity area. So the scheme that was set up by Justin Greening to really try and improve social mobility within 12 of our most deprived areas within the UK. And off the back of the opportunity area sort of a piece of work, we managed to create the Centre for Applied Education Research, which is a partnership that recognises no organisation owns our children and young sort of our people and recognises the need for everybody to work together in order to start tackling the issues that we all want to see sort of changed. So it's a fantastic partnership that brings together health and education with sort of support from both the local sort of government and also sort of central sort of government. And what that infrastructure gives us is this ability to start using our data sets to drive community sort of insights that then allow us to start trialing and testing and using the powerful tools that we have within sort of our science to collect sort of our data and evidence, then start implementing creative and innovative approaches, co-designing and testing and translating the outcomes before we sort of start running large randomized control trials and then starting to roll those out at regional and then ultimately sort of a national sort of a level. The point about the Centre for Applied Education Research is it's fantastic, and I believe we really, really benefit from it in Bradford. There's nothing special about it. It's simply a place where organisations got together, schools, health services, and anybody else who cared about sort of children, and said, how can we put our organisational barriers to one side and find a safe space where we can come together and work together in order to change outcomes for children and young sort of people. That's all it is. There's no reason why there shouldn't be a Centre for Applied Education Research in every area throughout the UK. So the third component, the third ingredient I want to consider today is our work to act together as one to improve autism services. So we developed our autism plan over the last sort of a few years. And what we really wanted to do is better understand why Why are we doing so badly in supporting children with autistic needs? And what we really wanted to do is kind of use that as a sort of vehicle to help us understand more generally our difficulty in supporting the needs of children with disabilities. So we looked across the district using our connected data sets to start trying to understand what is happening with our autism sort of services. Why is it that year after year after year, we keep saying we're not doing well enough? And it's not simply an issue of investment, because we've tried to throw investment at this sort of a problem on numerous occasions, and just nothing seems to stick. We just seem to go from bad to worse. So we wanted to get a proper understanding of the situation using our connected data sets. So what did we find? Well, the first thing we found, and this is no surprise, that our autism services are broken. And that's not because we don't have brilliant, dedicated clinicians. And that's not because our organisations don't care passionately about these problems. This isn't a blame game. It's just a recognition that something is going horribly, horribly wrong. Just look at our waiting list. We have over 1,500 children on our waiting list who are going to wait between 1.5 and 5 years' time to be assessed for problems that their parents are sort of flagging up at a much sort of earlier sort of a stage. And when we looked at our data sets, we could just see the huge numbers of children whose needs aren't being met and identified until late in primary, often right in sort of secondary sort of a school. And the other thing that we found when we looked at our sort of a data sort of set were just the horrible structural inequalities that exist. So when we look at our data, we can see that mothers who have educational qualification are having their children's needs identified and met 2 years in advance of mothers who don't have educational qualifications. And then we see that the children born to mothers of South Asian heritage are being diagnosed and having their needs met many years later than their white British sort of counterparts. So the data just show the structural inequalities playing out. The fourth thing that we found, and this is where things get exciting, is that routine data can actually help us identify children at risk of autism at the point of school entry. And I'll talk a little bit about that in just a moment. But what that then suggested to us is that there were new ways, exciting sort of ways that we could perhaps just deal with one part of the jigsaw sort of a puzzle in trying to better support children with sort of autism. And that's use routine data to identify children at risk. And then instead of then trying to get those sort of children into one or other of our many and convoluted autism pathways, we could simply send our services into the schools. And when we did that, we found that it was incredibly effective. So let me just briefly mention the work, and if people want details on this, we published all this sort of work and got lots of reports that I can send sort of our people. But we could use our Born in Bradford sort of a data set to look at children as they were being diagnosed with autism. And then because it's a rich sort of data set, of course, we could go back in time. We could look back in time and say, well, what were the red flags that could have told us earlier that these children were going to end up with their diagnosis of autism? And what we found was that the early here foundation stage profile was a really powerful predictor of subsequent diagnoses of autism. So a child who was performing poorly on this score was up to 70 times more likely to end up with diagnosis of autism. So we said, OK, well, this gives us a massive head start. So let's identify those sort of children that we're just picking up through routine data. Then let's ask the schools to do a simple sort of a screening sort of measure. And then any child that we then think needs an assessment, we will assess within the school sort of a premise. So we sent the teams into school premise, and processes that would take us 2 weeks within our normal pathways were happening within a day. And everybody involved in that sort of system said how much better this was. So we have a large number of South Asian community heritages within our Bradford sort of a district, and we find that a number of those sort of groups sometimes are unhappy about operating within our sort of a CAMS because there's a lot of stigma attached to mental health. But we found all those families were perfectly happy to interact with the school, and the school were fantastic partners in this sort of work. And And it really was a very exciting sort of a time for us, because what we then found is that we could get better sort of assessments, because we'd have the sort of teachers and the head sort of teachers and sort of Senko's input into that sort of a process, and then we could immediately start talking about the sort of support that could be put into place to support the sort of children. So we really found this an exciting and innovative approach. So what we're now trying to do is scale up that work, and we've developed a program that we call Success, which is supporting understanding of children's communication, emotional and social skills. But what's happened is that we've tried to try and trial that sort of approach. It's just started really exciting conversations right across the sort of a district, which is, hang on, this whole sort of system isn't fit for a purpose. And just really phenomenal sort of discussions between different colleagues. I see Julia Elliott's on this sort of a call, brilliant sort of a colleague who's joining these sort of conversations together with our school leaders, together with our Senkos, together with our local authority sort of colleagues in educational psychology, together with everybody, starting to sort of say, how do we start sort of shifting from this diagnose-led system to a system which is needs sort of based? How can we start using insights from schools early to start wrapping around sort of support right from the outset, and then starting to filter children and young sort of people. So we start meeting their sort of needs, and then as we find that there are some children whose needs aren't being sort of met, how do we then get those more sort of specialist sort of services being brought into sort of play? So that's what we're doing right now. And in order to do that, as you'll have guessed, we're getting all of the stakeholders together. So about, what was it, 6 weeks ago or so, in this sort of a building, we brought everybody together in order to start thrashing out how we're all going to change across the whole system to start delivering our services more effectively. And in order to make that a reality, we made sure we got the mandates and permissions. So Kirsten England, the CEO of the local authority, Teresa Patton, the CEO of our care trust, Mel Pickup, CEO of the hospital trust, everybody sort of signed up to that and said, my organisation is committed to remove those organisational barriers in order that our practitioners can do what they need to do to sort these sort of problems out. And I think this is a key sort of a component. We need that high level cover so that practitioners can make the changes they know need to happen. And in order to make this a reality, what we're doing is taking the principles of proportional universalism. And that's got many practical advantages, because you can't just suddenly change a whole sort of a system across the whole district. So we're starting off with the most deprived areas, which allows us to bring together the stakeholders in those sort of areas to start testing and trialing those sort of solutions, which then means we can then start acting at pace to sort of scale up across the different places in the sort of a district. And at the heart of all this is the schools and educational sort of settings. So we're engaging with the schools and the most deprived sort of our communities. But we've got to do this in partnership with our communities. And that means developing communication strategies. Everybody's got to be signed up to this. And that means businesses, it means our health services, it means our local authority, it means our sort of our communities. Everybody's got to work together to make this a reality. So this is what we're doing right now. We are building Data One, our digitally acting together as one strategy. And it's our belief that these tools that we're sort of developing will allow a frontline practitioner to identify risk and intervene earlier. It will help that communication between sort of our practitioners. And it's also going to allow our commissioners to make smarter decisions when they can't start sort of seeing where all the sort of costs are accruing later on in the sort of system that could be avoided if we put a little bit of investment earlier in the process. So there are a number of different components to this sort of work. We're dividing to conquer. So we have a team of brilliant data scientists who are starting to look at how we can take models like the one used in Bristol to start connecting up the different data sets and start putting those data into the hands of our practitioners so that they can make decisions more effectively and they can work with other practitioners in really efficient ways. We're taking this place-based approach, so we're really starting to try and use these sort of data within these sort of school sort of settings to start understanding the needs of a particular sort of community. So this isn't just a simple drag and drop sort of solution. We can use these data sort of tools to take context into account. So it really is the realization of that vision that we should be place-based in our service delivery. Communication is a huge part of what we need to do. As I say, we've got to take everybody on this sort of a journey together. So we work with artists and cultural practitioners who do wonderful sort of things. So we've taken all the Born in Bradford sort of data and they've produced a virtual reality experience that you can fly around the data and start sort of seeing how, when you start seeing the intersections and interactions between data, you can start to sort of understand sort of patterns that can then help us rebuild the world in the way that we want to. I assume these sort of slides will be sort of shared, in which case go onto that sort of link that I put there, and you can see this incredible work that the artists and cultural practitioners have produced in partnership with our children and young people. Data always alarms sort of our people, and rightly sort of so. I care about the information that's held on me, and I care passionately about the data that are held on children, young sort of our people. This has got to be done ethically. And one way that you do it ethically is you make sure this is done in partnership with our communities. But there is a big piece of work that we're doing to make sure that this is done ethically, in order to really make certain that the changes that we're trying to drive sort of forward won't be set back by sort of debates about this or that, but really those sort of debates will be about how we can move from a completely unacceptable sort of system where we're failing in our safeguarding duties and we're failing to meet the needs of sort of young people, to a sort of system that we can genuinely be proud in, that everybody on this sort of call will ultimately think, do you know what, when we're all sort of whatever sort of age and looking sort of at our back, thank goodness that we did intervene, that we did start taking inequality seriously, and we did make the changes that are necessary to make sure every child with disability has the very, very best possible start in life. And that's where I'll leave it.
Thank you, Mark. That was inspiring. There is so much stuff going through, and you beat the applause. Clap on me too for the afternoon session. That was just really, really interesting. I suppose for me, wow, says one of our parent carer reps. And I suppose for me, it was because it was rooted in equality and inequality, and also the fact that you're taking on some of the real challenges, for example, about ethnicity and poverty. Because they're really difficult conversations, but it's really, really good to have. Some of my team who love data and want to make it work and believe in the power of it will certainly be wanting to talk to you further. And I think what I've said in the slides, just so much coming back, is there's also so much learning in your slides that some of us are going to want to think about and reflect on. So if you're happy, Mark, to keep us up to date with what's happening in Data One, then we'd be very delighted to be part of it and contribute to it and get other people to think, as you say, how can that apply, not just in Bradford, but in the other areas around the country where the same issues are present.
Well, absolutely. We love sort of partnerships sort of working. We love sort of sharing learning, and we love to learn from other areas. I think we've got to develop a community of practice. It just gets back to my sort of point. If we're serious about this, we should just be putting, you know, our geographical sort of differences to one side, our organisational differences to one sort of side, and just start working out how we share sort of our learning and how we work together to drive the debate around these issues.
Totally right. The previous minister, Children's Minister Vicky Ford, was very, very keen on this piece of work, and I couldn't quite get to why it made us so excited. And as a politician, that's fairly rare. But now that I've heard it, I can see why she was so excited. So the chat, maybe we ought to capture the chat for you, Mark, and then when you're having a bad day and things aren't going as well as they might, we can put these comments up in front of you, because it will give you the incentive to keep going. So thank you very much indeed. I'm going to hand over to Amanda now.
That's very kind of you, Christine. I don't think we've got any time for questions, and I think Mark's presentation was very full anyway, so in a great way. So I am going to give you a whole 2 minutes before your workshop. So session 1 runs from 3 to 3:40, and session 2 from 3:50 to 4:30. So you will have had an email from Marie letting you know what your workshop is. Can you please make sure, Marie's also just put in the chat the feedback form. So we do really appreciate you taking the time to do the feedback form, because it helps us to plan for future events, but also we are asked by DFE to collect that data, so it is really important for us in terms of being able to demonstrate what we've done and whether or not people found it useful. So if anybody thinks they want to go to a workshop and hasn't had an email from Marie, then please do email her. Marie, if you don't mind just sticking your email in the chat again, just so people have got it at the top of there. And then there's just a little plug around Head Start and a Head Start event on the 20th of October, if any of you are interested. And just a quick reminder, Head Start is the National Lottery funded programme which has been supporting children and young people's mental health. So they're going to be sharing some of their learning at that event. So do sign up if you're interested. So yeah, anyone who hasn't got a workshop, let Marie know. Please do the feedback form, and as ever, thank you very much. These events are as good as they are because you come to them, basically. We always really enjoy the incredible activity on the chat. And sorry, we haven't had more time for questions today, but there was an awful lot of really rich content to get through. So I hope you will forgive us. Say
that those of us who haven't got the chat, who can't access it or access any of the slides, we have no idea how to get into or what can be allocated to, because we haven't got the email or anything.
Okay. Marie, can you email Gillian Travass? Anyone else experiencing the same difficulties as Gillian? Put your hand up, or I'm hoping that if you can't have access to the chat, you can at least put your hand up, just so that we can capture anyone. Is it just Gillian? And also Monica Call. If you can email them their workshop choices, please, Marie, so that they know what they're doing. Is it just Gillian and Monica? Anyone else before we say a fond farewell to you from the plenary? No, I'm going to take silence as a positive and assume that everybody else knows where they're going and has an invitation. Thank you again for coming along, and we'll look forward to seeing you next time.